We continue our study of reproductive system pathology, and we move to the female of the species, and we're going to study pathologies that can affect morbidity and mortality, but also quality of sexual relationship satisfaction in that, and pathologies associated with the female menstrual cycle. So the first condition with which we'll deal is endometriosis, and this is where lining of the uterus can be implanted distant from the uterus in various other sites. Excuse me. And when that occurs on a monthly cycle, the tissues that should be in the uterus but are extrauterine will go through the same buildup of endometrial tissue, and there'll be engorgement of blood and then sloughing of blood in that area, and that is a chronic inflammatory reality that can lead to scarring, but it increases the likelihood of monthly pain, and it can be a very significant pain that can alter the quality of life. So on the PowerPoint you can see where the typical implantation of endometrial tissue has been documented. Not represented here, but it's been reported that endometrial tissue being deposited in the lungs, and you can imagine that in the menstrual cycle this person would have difficulty breathing with the engorgement of blood in those particular tissues taking up space in the lung and leading to obstruction. And in all of these sites, scar tissue can be developed and lead to long-term health challenges. The theories of endometriosis are listed for you here. I think you'll find it intriguing. Not going to read the list to you, but available to you in your reading and in your PowerPoint. The prognosis, maybe what I would say the cascade of pathology, is that where the endometrial deposition occurs in these various places, primarily in the pelvis, there'll be a cycle or a progression from hemorrhage in that location to fibrosis to stenosis. And so people who have advanced cases of this, high volume of endometrial implantation, will end up having scarring around that area. And if it's in multiple sites in the abdomen, this person can become filled with scar tissue, and the resultant stenoses would be noted by big discomfort. You know that painful menses is called dysmenorrhea, and this can play into endometrial changes. But when there's an implantation of endometrial tissue in the uterosacral ligament, it's very, very painful, and provided for you sites of the manifestation of pain for various types of pathologies, and obviously this could be located here. If the endometrial tissue is planted in the ovaries, then the pain pattern would be more lateral over the ovaries. And then all of this can lead to a condition known as dyspareunia. As a result of vaginal scarring, this can result in painful coitus. The vagina becomes stenosed, and it's very, very uncomfortable for the female during sexual relations. The next condition with which we want to deal has a linkage to a particular kind of hepatitis that we studied in our studies of infection is the human papillomavirus, HPV, and this can be prodromal to cervical cancer. 1/3 of American females has HPV, which is a sexually transmitted disease, and the sequel to HPV can be cancer. Well, you can see that because this is at epidemic proportion, 1/3 of the female population has this type of virus, the risk of reproductive system cancer, in this particular case cervical cancer, is also epidemic. And then we know that things work well when a man's semen or a sperm cell interacts with a woman's ovum and a pregnancy results. Well, everything goes well if that union and the attachment of the zygote onto the uterine wall, well, life has begun right there. But if that union happens distant from the uterus, in the fallopian tubes, or in the ovary, been reported that there's not a chance for the development of this fetus because of the narrow space that's here. And this can result in tremendous pain because confined space, increasing volume in the confined space, that's when some of the most painful conditions can be realized, and there's not a chance for this fetus to develop. Now, this can result in a ruptured fallopian tube and intra-pelvic bleed, and that can be a serious problem. Obviously, it can lead to a hemorrhagic condition that leads to hypovolemic shock and be very threatening to the person's life. Here are the signs and symptoms of ectopic pregnancy. Appreciate the fact that this leads to a condition called lancinating pain, which is 10 out of 10, knock you over, make you vomit, and the person has symptoms of pregnancy, but there's going to be, which is cessation of menses, and spotting will result. And this needs to be addressed before there's rupture of the fallopian tube. And provide for you a laparoscopic view. Here's the uterus, and right where it says E is where the ectopic pregnancy is manifested in the fallopian tube. Okay, and then a condition that can occur in the female is polycystic ovarian disease. This is where cysts are formed throughout the ovaries, and the timeliness of the maturation of the ovum gets out of sync, and multiples of these occur prematurely, here and here or here, and this becomes a threat to the woman's capacity to release one ovum a month, and this can be very uncomfortable, and it's a threat to fecundity, or the capacity to reproduce. Signs and symptoms associated with polycystic ovarian disease: obesity, hirsutism, which is the laying down of extra hair on the body, infertility, and menstrual irregularities. Now, the treatment of this, the pharmacopoeia that's available, is the administration of hormone therapy. And then one of the deadly cancers of any type of cancer, but in particular in females, is ovarian cancer. Because there's such a turnover of tissues as the ovum is formed, this is a place where the tissues can, the cells can have changes, and the prognosis is not way good. This can be treated, but it is also a very virulent type of cancer typically. Signs and symptoms of ovarian cancer are listed for you on the PowerPoint. You can see the manifestation of a cancerous ovary, thoracic pain, shoulder girdle pain, ascites, vaginal bleeding, weight loss, and cachexia. And prevention is to have babies, breastfeed the children, and use oral contraception. So internalize this. What do? Well, fewer and fewer women are having babies, so ovarian cancer is on the rise is one thing. I shouldn't say that it's a guarantee if you have babies that you will never have ovarian cancer, because that's obviously not true, but you reduce the risks. The data indicates that women who do have babies and breastfeed their babies have lower incidence of this. And then, particularly see, that's the positive of having kids. The negative of having kids, multiple children, called multiparous, is that women become vulnerable to these three conditions. Cystocele is where the urinary bladder will protrude. I've got to get to where it says cystocele right here. The urinary bladder can travel toward the pelvic floor, the perineum, and actually bulge into the perineum. Bladder prolapse, okay? And then rectocele is where the rectum will bulge through the anus. I'm so sorry, I have to see these things in reverse, but the rectum will protrude into the perineal area and obviously cause pressure sensations and change toileting practices. And then uterine prolapse is where the uterus falls into the pelvic floor. Now, the etiology of this is, like I said, women who've given birth are vulnerable to all three of these conditions. So normally these are conditions associated with decade 4 and beyond. And also it's, you could say, loss of muscle tone and elasticity of the suspensory ligament support. And so doing Kegels, developing good tone in the muscles of the pelvic floor is helpful. Muscle re-education, and perhaps a surgical reconstruction. Fibrocystic breast disease can be prodromal to breast cancer. Prevention of breast cancer include adequate breast support with clothing. Breast reduction is a possibility, and then moderating coffee, tea, cola, and chocolate. And there's an imperative for regular assessment with mammograms and breast self-exam, which will be doing a public health practice in terms of teaching women how to do breast exam. Early detection breast exam and mammogram. Benign breast neoplasms. If lumps occur in the breast, the lump is smooth and rubbery. Typically that's benign. Contrast that with breast cancer, and if that lump is 2 centimeters or less, it's firm, irregular, and not mobile, that's stage 1. But if the lump is fixed and enlarging, then that's indication that cancer may be present.